Data collection can be easy if it's well planned out. Well, when I say it can be easy, what I mean is that it doesn't need to be this Herculean task. We should, however, go over some absolute necessities of making it well planned out. For the direct observation, when we're looking at frequency or duration, or other methods or other measures such as latency or magnitude, and we'll go over those at a later time though. But the point is that for direct observation, we need to make sure that we know what we're actually looking for. We need to operationalize the behavior. As you will learn throughout this training, behavior should be defined in a more objective way. And this is one of those reasons. We need to know what we're actually looking at. So I wouldn't say to take a frequency count on when a person is mad, because what you think is mad might be different than what I think is mad. Instead, I'm going to operationalize the behavior, define it in a way where I could give this measurement system to someone, say, in South America, and they'd be able to come up here and take data and actually get an accurate recording of it. So instead of saying someone's mad, I'm going to say something like, we'll hit his head with an open fist, or we'll scream at a high pitch, or we'll cry for at least 30 seconds. Those are all better ways to operationalize it, so that way another person can come in and do the observation. The analyst should provide a data sheet. Remember, RBTs do not design data sheets. And like with anything, practice is going to be better. The analyst should practice with you, or the case supervisor, so that you know what behavior you're looking for. The point I want you to take away from this, though, is that about the operationally defining the behavior. This is why we ask for behavior to be defined this way, so that we actually know what we're looking at. An operational definition is a specific and measurable description of the behavior in question. There are two examples here. Ricky hits other children. That's example 1. That would not be such a good operational definition. Because what actually constitutes a hit? What if he just comes up and taps the person? Remember, we're trying to have someone else, the question we should ask ourselves is, if someone else used this definition, could they actually see what we're seeing? So while Ricky hits other children is a definition of what's going on, it doesn't actually provide the objectivity that we're needing. Example 2 is a better example of an operational definition. Ricky uses his closed or open fist to punch another child with significant force, and uses his legs to kick other children with significant force during classroom time. So again, in example 1, it's not detailed enough. I've worked where I had a person taking data on hitting for me. I forgot to mention when I was operationally defining it that hitting also included kicking. So when I got the data back, I noticed that when I wasn't there was a lot less hitting going on. That's because I wasn't having the person track kicking as well. It's one of those things I've learned, is that you have to be as detailed as possible. And that you can see that in example 2. Okay, in example 2, I included everything, right? Both hitting with a fist, with open and closed, and also kicking. Point being, an operational definition is a specific and measurable description of the behavior in question. It is objective. Here's another example with our good friend Ricky. Ricky gets out of his chair during program. Well, what happens if he just basically leans out of his chair? What does getting out of his chair actually mean? Example 4 gives us a better definition of this. Ricky gets out of his chair completely, with no body part touching the chair for at least 5 seconds. That is much more objective. and the person would probably be able to much more understand what that behavior actually looks like. You'll be writing all this data down, whether trial by trial, ABC data, narrative, direct observation, whatever, on data sheets. Data sheets allow us to measure what we want to. Sometimes they're very specific to the agency. Sometimes they're specific only to that patient. The point is, though, is the analyst designs these and provides these. They may be providing it for the agency, such as Learning Arts. The point I want to make, though, is that the RBT, as an RBT, it is not your responsibility to design them. You'll be using them in a prescribed way to track data. So why do we take data? We take data to make sure what we are doing is actually working, to make alterations based on how successful the intervention is going, and to look at something over time, to look at the data trend over time. As you will find out through this orientation, behavior analyst, when we're talking about behavior, we want to look at it how it's changing over time. Taking data can be difficult. We know that you are managing behaviors, that you are doing programs. But remember, we need to practice taking accurate data so that way we can track what's going on. This is why I always implore you during your field training to get as experienced with this as possible and to practice this. Over time, it will become easier. I'm not saying you have to be perfect right away. Another thing I really want to emphasize is that behavior change is typically not quick. And as a behavior analyst and as an RBT, I want to implore you to start looking at the big overall picture. This stuff happens over time. Skills acquisition over time. For example, this summer, this is 2016, the summer of 2016, we have a local pool at the high school where I live. It took me 3.5 weeks, basically three sessions with my own 4-year-old before he would even go underwater. And we were practicing each time we were there. I may have become discouraged after that first time, but I kept at it because I understood that it was going to happen over a longer period of time. And as an RBT, I want you to realize that, to understand that the impact you see may be slow at first. But it's also another benefit of taking accurate data, because we can see those changes even if they're small. For example, one time I was working with a patient who we didn't seem like was making too much progress. We couldn't really see huge differences. But when I looked at the data, I noticed that on average they were getting 2 or 3 more correct responses every time we did programs. Eventually, that became 10 more correct responses. And eventually, they started doing very, very well. The point being, though, is that behavior change is not typically quick. I'm not saying that as a general rule, sometimes it can be. But we do want to look at the overall picture. So, why do we have you take data? Well, we need to graph the data, or we need to see how things are going. One of the key tenets of applied behavior analysis is known as visual analysis, where we represent the data visually. As a behavior analyst, I do this so that I can show the stakeholders, or who we're working with, and who our patients are, or our patients' guardians and parents, or who the client is, if progress is actually being made. It is not to say that behavior analysts don't care about statistics. We do. It's just that if we can visually represent it, if we can show it, this can be a very powerful tool. After all, people can understand graphs even without a lot of training in it. And it can be difficult to glean something from a set of numbers without seeing it represented visually. Remember, we're looking at what's called longitudinal data. That was that idea earlier I talked about how we are looking over a time period. We don't want to lose track of the big picture. Individual days and successes are always meaningful, but we don't want to track that big picture. We don't ever want to lose track of that big picture, rather. So here's an example of what a graph might look like, or how we represent data visually. This is looking at homework completion. As you can see, over time, that homework completion is improving. I don't need to show you statistics, I don't need to show you numbers. You can see that over time, the completion is going up. Here's another example of a graph. This may be actually how the graph might look when we're looking at target items, where we have different shapes that the person is learning. As an analyst, I have been trained to look at these graphs and to notice patterns or trends. When looking at this graph, I noticed that responding is very sporadic. It's highly variable. That might mean we need to change something. We might need to make a more consistent instruction or use different types of reinforcement. But the overall trend, rather, though, is still increasing. The person is getting more correct responses or getting better at it over time. So again, it is the job of the analyst to analyze these graphs. That's what I want you to take away from this. But as an RBT, you will be entering data in data sheets. And you should be familiar with how to make a graph, and I will do that later with you during this orientation, as it is part of the RBT task list. But for right now, I just want you to see a couple of examples of these graphs. Here's another example. If you notice the red line in this advanced imitation programs, there was one day when the person had a bad day, right? But then their trend started going back upwards. As an analyst, I make it my job to look at data over time. Because imagine if I had just taken that one day when they got 0%. We might have said, hey, we're done with this program. This person's not making any progress. But because we're looking at it over time, we can see that yes, indeed, it is working. And that was just one bad day. If you notice the blue line, it's staying pretty low. That suggests we should make some sort of modification. That they're having a difficult time with that particular item. We are keeping track of our patients' progress continuously. We want to make sure that they are making adequate progress. But what is adequate progress? It is difficult and is truly hard to determine. But I want you to keep the following in mind. This is a graph that I made for developmental trajectory. It's kind of crude, but let's see if we can follow along. The blue line represents traditional developmental trajectory. When a person is 1 year old chronologically, they are also 1 year old mentally. When they are 2 years old chronologically, they are also 2 years old mentally, and so forth. This is represented by the blue line. The red line is a developmental trajectory of someone who's falling behind, perhaps because of a developmental disability or disorder such as autism. Here, maybe that 1 year old person mentally is also like a 1 year old chronologically, but that trajectory starts to slow down. It starts to decrease. So they become 2 years old chronologically, but mentally they're only operating at like a year and a half year old. And that red line just keeps, and the trajectory is slowing down. So that by the time they're 3 chronologically, they're only acting like a 1/2, maybe 2 year old, and so forth and so forth. The point is that because of the delay, they are getting further and further behind from their peers. This is one of the reasons why, when we're talking about early intervention, whether for children with autism or anyone else, is very important. Because as a person gets older, that gap between themselves and a typically developing person gets wider and wider. The green line represents intervention. What happens when we start doing intervention? Our ultimate goal is to correct this trajectory. Well, I don't know if I want to say it's our ultimate goal, but it's one of our goals, right? Is to get that trajectory and to get them kind of back onto the age typical development. The point being, though, is that let's say we have a 4 year old. And that 4 year old is chronologically 4 years old. That means they're 4 years old physically. But mentally, they're operating at about a 2 year old. That means they're 2 years behind. So, if we catch them up on their skills, or we teach them skills, but we're not teaching enough, and we only teach them a year's worth of skill in a year, that means by the time they're 5, chronologically, they're mentally only 3, right? Because we only taught them a year's worth of skills. So our job as behavior analysts, and by extension RBTs, we're teaching them, this is why repetition, and we do so much intensive work, is we're trying to teach them faster, to have them learn faster than their peers, so that we can make bigger gains. We want to make at least an 18-month gain in 12 months, so that we can start to catch them up to their peers. This is incredibly important for those with a large gap between their chronological age and what they're operating at, the type of age they're operating at. Basically what I'm trying to say is that we need to catch them up. So if you go back to the idea of what is adequate progress, well, if they're making very slow progress, if they're not actually improving, we would need to change something. Likewise, if they're only making progress as fast as their peers, we're going to want to get that a little faster. This is a very difficult thing to say because each patient is going to be very different. It's going to be really dependent on the patient. However, the point is that we want to get the progress to a point where the person is essentially learning faster than their peers, because we want to catch them up. So adequate progress is going to be different between clients. It is the role of the analyst, the behavior analyst, to determine whether progress is sufficient. As an RBT, it is your job to do the intervention as prescribed. So in essence, the child needs to be learning at a faster pace than even their typically developing peers are. This is why effective intervention programs are very intensive. This is why, as an RBT, you're going to be engaging in as many learning opportunities with that person as possible and providing that enriched environment. Because we need them to get caught up. We need to get that. Our goal is to get that individual to be as independent as possible. That means that we're going to be working on skills at a pretty intense rate. I want to end this conversation with talking about trial-by-trial data. This will be taking data for each trial of the program you run. It's a form of direct observation because you're observing the behavior as it happens. I don't want to get too specific into it because this will be making a lot more sense when you're actually running the program with the individual. And we'll talk a little bit more about this later. But what I want to talk about is the importance of making sure that you know what a correct response is and what an incorrect or prompted response is. I want you to make sure, as the RBT, to know what you're counting as the correct response. And that's going to depend on the program, and I'm not going to go into that yet. The point, though, is that this data should be accurate as possible, because we want to know if what we're doing is actually working. We do ourselves no favor if we kind of bake the data and basically try to say that progress is happening when it's not. As an RBT, it is your responsibility to do the program as prescribed. One of the advice I want to give you is that even if you do the program, or rather, let me start that over. Even if the child is not making progress on that particular day, or not engaging in the correct responses, that is no reflection on how you are actually working the program. If you are doing everything correct, but the child isn't getting correct answers that day, that's okay. I met lots of RBTs, lots of techs who think that they're failing or not doing well because the child's not making much progress. Again, it is your responsibility. You cannot force the person to engage in the behavior. But you can complete the trials as outlined in the behavior plan or in the skill acquisition sheet. So as an RBT, yes, there will be days when you're doing everything totally right and that person is not getting the correct answers, and that's okay. So I want to thank you for listening to this presentation on this was the initial presentation, kind of introduction to data. We'll be getting into this a little bit more detail later. But right now I just want you to understand that we do collect data, and I want you to understand what it is. So remember, data is basically anything that we can observe through our senses and keep track of. And as RBT, you'll be keeping track of behavior data, trial by trial data, narration data, narrative data, ABC data, and whatever else type of data that the analyst may be having you record. Thank you.